Well, good afternoon, everyone. Thank you for joining us for our press briefing on with regard to the state slowing the spread of coronavirus here in Nebraska. As always, we want to hit upon our 6 rules. Again, we want people to not take any unnecessary trips outside the household, to work in a socially distanced way, 6 feet away, or work from home when you can. Still encourage employers to be able to work with people to be able to work from home. To shop once a week by yourself. Don't take the whole family shopping. To help kids be able to socially distance by keeping them at home, avoiding group sports and playgrounds. Also help seniors by shopping for them so they can stay home or running errands for them, but do not go visit them in a long-term care facility. And then finally, make sure you exercise so that you can do that daily in a socially distanced way or doing it at home. So these are kind of our 6 reminders to keep Nebraska healthy. And then also, just a couple other things to clarify. With regard to when I say social distancing, I mean things like keeping that 6-foot distance between you and somebody else. And that we will be looking at things like that as part of examples of that. It doesn't mean that everybody has to stay, we're not in a shelter-in-place kind of thing from now until we get a vaccine. It's really about making sure we're just practicing those good social distancing, physical distancing kind of things, like keeping 6 feet distance between you, wearing a mask when you're going in public. If you're going to the store, wear a mask. That's a great idea. Also, washing your hands often for 20 seconds at a time, staying home when you're sick and everybody in your household stays home. These are the kind of things I'm talking about as I'm talking about how we're going to manage this throughout the course of the rest of the year. So I just wanted to make sure, because we had some questions on that, to kind of talk about that ahead of time. And of course, all these restrictions that we're doing have to do with regard to making sure we preserve the hospital system. And we've done that wonderfully well here in Nebraska. We've got 44% of our hospital beds available, 38% of our ICU beds available, and 78% of our ventilators available. So lots of capacity in our hospital system. Also want to remind people about testnebraska.com, that we want people to sign up for that. We've got about 145,000 people that have signed up. It's a great way to be able to help us get an assessment of what's going on in the state, to then be able to schedule that testing that we're doing around the state. So please sign up for testnebraska.com. It'll take you less than 5 minutes to do it. Your data is secure. It's not going to be sold. It's not going to be given to other government agencies. It's only going to be used for this testing program. And next week, when we're for testnebraska.com, we'll be testing in Omaha, Lincoln, Hastings, Kearney, York, Seward, and Beatrice. So we will continue to be moving around the state with our mobile testing sites. So please sign up for testnebraska.com. We are prioritizing healthcare workers, first responders, food processing workers, but also people who are 65 or older, and then of course people who are symptomatic to be able to get in and get tested. So this is Mental Health Awareness Month and Child Mental Health Awareness Month. Now, mental health is something that is incredibly important and really should be treated as just like a physical health, right? The same sort of issues that go along with behavioral health can be treated just like they can be treated for physical health. And we know prevention works just like it does for physical health. Treatment works, recovery works, all that. Recovery is possible. And as much as 20% of adults may have some sort of behavioral health issue throughout the course of their lifetime. And we know that mental illness can also begin at a young age, that if you're 50% of mental health issues may start as young as 14 or 75% by the time you're 24. So right now with this pandemic, we've all been feeling the impacts of this. In fact, Americans are saying in surveys that they feel like their mental health is being impacted by the isolation and all the other stress that goes along with this pandemic. And so we want to make sure we're taking care of our mental health just like we're taking care of our physical health. And so every day I talk about exercising daily. Well, we're going to have Sherry Dawson come up here to talk about some of the things that we can do. She is the person in charge of our behavioral health division at the Department of Health and Human Services. But before she comes up, I'm going to go ahead and sign a proclamation proclaiming this Mental Health and Child Mental Health Month here in Nebraska. So we have this proclamation to raise awareness about mental health. And Sherry, if you come up and you can accept this and take it back to the office and then tell us a little bit about mental health here in Nebraska.
Very good.
Great.
Thank you
Thank
so
you.
much. So it's a pleasure that every May we get to have these celebrations and awareness. And again, if you think about 1 in 5 Nebraskans experience a mental illness or substance use, and that includes adults and children. And so when you think about just the impact of 1 in 5, and think about your church, your community, your neighborhood, your family, your friends, and 1 in 5 by statistics are likely people in this room. And so the opportunity we have, not only this month, but hopefully every day with mental health awareness, is that we can normalize the conversation about mental health and mental illness. So I want to thank the governor for his ongoing support and all our key partners who we have so many providers that are still out there serving individuals in creative ways. And we have all of our resources, like our helplines, still serving people. And there's probably never been a time where we haven't thought about increases just on a regular basis. So one of the things this month that we're really encouraging is for individuals to educate yourself. So I don't know if you want to show me by hands, but I'm going to ask you a question. If you can identify signs of a heart attack or signs of stroke, or if a person has diabetes, what are some of those symptoms? What kinds of activities do we do to save a life for physical health? We may take a CPR class. We may have a first aid class because we're trying to prevent injury and save lives. How many of you are aware of symptoms that somebody's in mental health distress? And how many of you know that there are mental health first aid classes for both adult and adolescents? And there is something called QPR, which is Question, Persuade, Refer, which is a class that helps individuals that know how to intervene with people that are really hopeless and thinking about suicide. So I'm going to challenge you, if you've taken a first aid course and CPR, then you should also, in the pandemic, when the classes are all available, take mental health first aid and QPR. Now, the signs that we want you to be in tune with, we basically group things into 5 signs. So the first one is withdrawal. So you have a change in behavior on how you're interacting with individuals. We also have agitation. It's about how you're experiencing your mood. You may be more angry, more irritable, but there's a change in how that mood is feeling for people. Hopelessness. It feels like you just can't get out of what you're experiencing. And then we think about what you do every day. You may change your routine. You may want to sleep all day. You may not want to get dressed or put makeup on that you might do on a regular basis. The chores and activities, you just have really a change in that behavior. And lastly, personality. You just aren't experiencing the joy. You're not experiencing life as usual. So those 5 signs are really important for everybody to have. Using the conversation power. We talk about be the one. Be the one that has the conversation and normalizes discussions about mental illness. I always give the example of a person that's experienced a heart attack. This could be a friend or a loved one. If you're in any social group, whether it be your neighborhood, your church, a family gathering, that person that had the heart attack likely has had discussion about their ambulance trip, which hospital they went to, which surgeon they had, the medications in the procedure. They had visitors. They probably got cards. They may have been on prayer chains. People may have brought food to the house to help support the family. Now, when we talk about changing the conversation, and we talk about a person that has experienced depression and had to be hospitalized, or a young person that has their first psychotic break and is diagnosed with schizophrenia, or a person that has experienced substance use treatment. Now, in those gatherings, are we having those same conversations? I had a chaplain once tell me that mental illness and substance use disorders aren't casserole diseases, that our society has a lot of opportunity to continue to have conversation and support one another with mental illness and substance use disorder. So the last time I was here, we talked about Wellness Wednesday. So the challenge today is to take 15 minutes today and do 15 minutes for me, right? Do some self-care. Whatever that activity is, music, relaxation, meditation, prayer, walks, it could be anything that is really helpful to your stress. And 15 minutes a day, you will be surprised what that will really do for your overall health. When we're talking about tips for adults' mental health, it's the things that we know that just are positive for our overall health. Things like sleeping, getting good sleep, exercising, practicing those 15 minutes for yourself, getting into a routine, having accountability partners, and staying connected and really having those conversations to help you de-stress when necessary. When we talk about children, we want to make sure for children's behavioral health that we are encouraging conversation as caregivers and adults, that there's nothing that children can't tell us, that we help them through anxiety or challenging times like we're experiencing now, and really helping them problem solve and helping them develop different coping skills. Sometimes they aren't in touch with their feelings and can't label them, but they act out. And so just putting into a routine a conversation about what's going on with them. And I will give you a tip, because I'm a parent of adult women, that the car for teenagers is a captive audience and they can't get out. And so try and create some moments too, not only for teenagers, but at children at mealtime, at bedtime, where you can really talk about feelings and coping and things that are on their mind. Lastly, I would just, again, thank all the providers that are out there and all of our resources that we have in terms of helplines. People aren't alone. And again, I'm challenging you in this month and every day to make sure that we're changing the conversation. It's okay to talk about this. This is a strength. I know as a parent, I called our healthcare provider multiple times. I didn't know if certain things were okay or not okay, what should I do? And yet, we don't always do that for mental health. We don't pick up the phone and call our healthcare provider. So I'm going to give you the Nebraska Family Helpline. You've heard that many times, but really, seriously, there's no problem. And as the governor talked about the impact of mental illness at young ages, the earlier the better. Don't let it get, just call. Any question, any problem, anytime. 1-888-866-8660. And with all the COVID and the loneliness, there is certainly some concern about suicide or suicidal thoughts. And we do have a national suicide prevention line. Young people can text that line, and it's also in Spanish. So all the resources that we have in Nebraska, we're lucky, but I need you as champions to help us with this awareness and encouraging conversation. So mental health matters, and it should be every day, not just this month. So thank you.
Thank you, Sherry, but two things. You took my notes,
Oh, gee. Secrets. There we go.
and you didn't take your proclamation.
Do you care if I use
You can
this
use that, yeah,
first?
you can use that too. Absolutely.
Thank you so much.
Yep, no
Appreciate
problem.
it.
That's why it's there, you use. All right, thank you very much, Sherry. Also, yesterday, we had, appreciate you talking about the mental health and reminding people, especially during this pandemic, to make sure they're taking care of their mental health, just like their physical health. Also, we had a question yesterday about an FTC, a story that some people had heard that Medicaid patients in long-term care facilities were asking to turn over their checks to the facility as part of their resources. At the time, I said, well, I can see why they might be thinking that. However, the FTC has put out an alert on this that that is actually not allowed. And so if you're a family member with somebody in a long-term care facility, you should probably check with them to make sure that they are not signing over that check to the facility. That is not what that check was designed for. It was not supposed to be counted as part of resources. So there's an FTC alert on that. You can probably go out there and Google it and find out. And the Google machine seems to know everything. You probably find that FTC alert. Okay, also schedule 2 o'clock this week Central Time for these English briefings, English language briefings, 5 p.m. tomorrow night, Spanish language briefing, tomorrow night, 8:30 to 9:30, speaking of Nebraska, be on NET. And then let's go ahead and jump into Q&A. Joe Jordan with News Channel Nebraska. Regarding the restaurant staff will need to be masked portion, did the governor misspeak? No, so again, just part of what we did yesterday, or we had a discussion about restaurant staff, so specifically servers and cashiers, not chefs or cooks, because they're working around the the ovens and everything like that. We're trying to make a distinction there because of their working conditions. But for the servers and the staff, people interfacing with the public, we've got guidelines that say they need to be masked. So we're expecting people to follow those guidelines. Now, we did not put it in the DHM because we were not looking to make that a misdemeanor offense. However, if we find that restaurants are not doing that, we can put that in the DHM and make that a requirement. So we really, just as we've done through most of this pandemic, ask people to do the right things. Nebraskans by and large have, so please, if you're a restaurant owner, if you're a restaurant manager, have your people who are interfacing with the public, those cashiers and servers, wear a mask, please. Okay. We are hearing anecdotally that many restaurant workers are not wearing masks. Is there confusion on this? Well, trying to clear up the confusion, they should be wearing masks. Again, if they're working in the kitchen, it's kind of a different story because of the working conditions there, but if you're a staff member who is dealing with the public, server, cashier, so forth, please wear a mask. If masks are not required, any discussion of requiring it, and again, I think I just covered that. So Tyson Hrvanik with KRGI. Yesterday, the Nebraska Business Development Center at UNO released a report on the impact of COVID-19 on the Nebraska business community. Can you give us a better understanding of how the data will be utilized when it comes to the plan for economic recovery in the state, given the fact that the data compiled is already a month old? So I think that, Tyson, when we're looking at this data, this is just one of the sources we'll be using, and as Kathy Lang said yesterday, we'll be doing another survey as well. But it's just one of the points of data that Tony Goins will be using as he's crafting his plan to get Nebraska growing. So the idea is that Tony will be using this data. He'll be talking to the Chambers of Commerce. He's created a team that is working on this recovery plan, so we're going to be leveraging their experience. We're going to be talking to other businesses. So this is just one of the points of data that we'll use as we think about that plan for recovery, and stay tuned on that because we'll be having more announcements with regard to that. Are there other ways the state is reaching out, or is there other data you were looking at when it comes to repairing the state's economy since being devastated by COVID-19? Again, just kind of the things I just mentioned. Jose Zozaya at KETV. With the news that Iowa has set May 28th as the day bars and other establishments that serve alcohol can reopen for indoor-outdoor seating at 50% capacity, has the state of Nebraska looked at when bars will be able to reopen with similar assessments? If so, is there a timetable with the guidelines they would have to follow? So again, we are looking at our DHMs, our directed health measures, are expected to expire May 31st. We are looking at what we will be doing for June. So I would say, Jose, just stay tuned. We'll be having announcements with regard to what that will look like. We understand bars have been particularly hard hit. Again, the survey we had yesterday, that includes that restaurant industry, and we know that that's one of the industries that's been particularly hard hit. So we'll have some announcements for that for the upcoming month of June. So again, just stay with us on that. We'll have some announcements. Ryan Boyd, KGFW, the general manager for the Kearney Raceway, asked about being able to conduct business in some fashion. He said he can respect the social distancing guidelines and keep attendees separated. The raceway is about a 20-acre plot of land, and he has more restrictions imposed than restaurants with 50% capacity in the area right now. He believes it would serve as a nice distraction from the virus for the public, and it would give them business. Wanted to know what the governor thought about this and if he can recommend anything at this time. So yes, again, for the owner of the raceway, again, through the month of May, continue to, again, follow the 10-person rule. If that's not practical for you, certainly understand with the raceway, you generally have more people there. But also, we will be having additional guidance coming out for June, so I would say just hang tight here for another couple of weeks. We'll have some guidance before the end of June with regard to how those outdoor venues can operate. Michelle Bandur, KETV, can you ask the governor if he plans to have a state day of mourning for the Nebraskans who have died of COVID-19? If not, will you have a special ceremony on Memorial Day? So we have had a day of prayer, and we continue to encourage people to pray for the people who are impacted by coronavirus, so please continue doing that. And with regard to the special Memorial Day ceremony, clearly Michelle's not watching every day because we had John Hilger here talking about our virtual ceremony we're going to have here at the Capitol. So again, we don't want people to have those typical Memorial Day gatherings. We're going to have a virtual ceremony here starting at 8 a.m. Monday morning, so please tune in for that. We will celebrate Memorial Day and remember those heroes, those men and women who have put on that uniform and given their life, as well as our veterans and their families who sacrificed for us. And we'll do that in a socially distanced way on Monday through that virtual ceremony. And with that, I have gone through these questions. Taylor, do you have some texted questions?
Yeah, so Lauren with MTV says that she wants to know if people can continue to consume alcohol after they finish eating at a restaurant. Is there a time limit before the table has to flip?
So Lauren NTV wants to know, can people continue to consume alcohol at a restaurant after they finish their meal? How long do they have? Again, that really will be up to the restaurant to determine how fast they want to turn that table around. What we are asking, though, is if you're going to order alcohol, you have to order food. So you have to actually get the food, receive it, and to be able to order alcohol and consume it. But it'll be up to the restaurant to decide how fast they want to turn that table.
And she wants to know if bar food like popcorn or pretzels counts as ordering food.
Does bar food like popcorn or pretzels count as ordering food? And the answer is no. Again, this is about ordering food. Like typically, if you go to a bar, you don't have to pay for the popcorn or the pretzels. Those are the things that are generally set on bar counters. By the way, you're not supposed to be sitting at the bar. So again, the idea here is the spirit of what we're talking about is if you're going to order alcohol at a restaurant, you have to be there to order a meal.
Once restaurants and bars are open, can they still continue to sell alcohol to go?
Once restaurants and bars are open, can they continue to sell alcohol to go? And the answer is yes, especially, certainly covered for the things that you traditionally do, like package, but also things like the mixed drinks. I believe that executive order, the ability to do that will be through the course of the emergency. So even if restaurants open, they can still sell that alcohol to go.
Mary Jane from the Kearney Hub has several questions about camping. Why was the decision made to permit only RV camper style camping when state park campgrounds reopened today?
So Mary Jane with NTV?
No, with the Kearney Hub.
With the Kearney Hub, I'm sorry. Mary Jane with the Kearney Hub is asking about the RV camping in the state parks. Game and Parks is actually what we call I call it a non-code agency. It's an agency that actually does not report to me. So the Game and Parks has a board of commissioners that the executive director reports to, and they set the policy for that. So I'd really refer any camping question to talk to those folks. Again, having had some conversations with them, I don't want to speak for them, but they were looking for ways to be able to start opening up the campgrounds and do it in a way that is socially distanced in an appropriate way, that physical distancing thing. So, but I would refer Mary Jane to go talk to the Game and Parks to get the details on how they came to their decision.
Mike McKnight with WOWT is asking if Nebraska wedding venues will follow Iowa's lead in allowing them to reopen.
Mike McKnight, WWT, is asking, hey, Iowa is planning on opening up their wedding venues. Is Nebraska going to follow suit? And again, I'd just say, Mike, just stay tuned. We're working through all that right now with regard to the month of June. So again, we've got our DHMs in place through the month of May. Those will stay in place as they are, but we are looking at what we're going to be doing for June and continue to further taking steps to loosen the requirements. And again, I want to emphasize we're taking steps, so it's a step-by-step process. It has worked so far in May. We loosened some restrictions May 4th. We continue to see that we've got a stable hospital system. If you look over the last 10 days or so, we've seen, everything stay within order with regard to that hospital system and cases and so forth. So we'll want to continue to see that through the month of May as well, but then we're making plans for June to loosen some restrictions further and take another step to allow people to live a more normal life. But again, get back to, we will be having some sort of restrictions on these types of events.
Jennifer Griswold with KMTV asks, is there any time frame for when travel recommendations will change?
Jennifer Griswold is asking about travel restrictions. Again, they're in the same category as everything else, so we're looking to have further guidance on that as we craft what we're going to do for June. So I'd say stay tuned with regard to that. We'll have some further guidance on it.
Charlie Brogan wants to know, is the current number of people assessed for Test Nebraska enough to keep up with scheduling people to get tested?
So Charlie Brogan wants to know, is the current scheduling able to keep up with the people who want to get tested? Is that what he's saying?
Do we have enough assessments to get people to fill the test slots?
Do we have enough assessments to get people to fill the test slots? Generally, we have been able to do that. I would say we still want people to sign up for testnebraska.com. So we've got lots of opportunities. I talked about how we have prioritized people. We can loosen some of those priorities to get more people in to be able to get tested, and we will as time goes on. And we are, just so you know, we're looking for additional ways to continue to expand testing outside of just Test Nebraska. But we do want people to get signed up for Test Nebraska so we can continue to make sure we have a full schedule of testing as we travel around the state with these mobile testing units, similar to what I've talked about, where they're going to be in York and Seward and Beatrice and so forth.
Rob McCartney says, the Associated Press has a poll showing that 54% of people are very concerned about reopening. Is that number concerning to you?
So Rob McCartney says there's a poll from the AP that shows that 54% of the people, 54% of people are very concerned about reopening. Is that a Nebraska poll or is that a national poll?
It's not clear.
Not clear if that's a Nebraska poll or a national poll. Well, again, this is why we're taking a step-by-step approach. We've, for example, opened restaurants to 50% capacity, and I would say that at least based upon what I hear is that we have seen some people be kind of cautious with regard to going back to restaurants. But again, people need to do it at the pace they're comfortable with. But I think that's not a bad thing. Again, we want to take this cautiously as we start opening up different aspects of society that have been more restricted. So we want to take this in a step-by-step approach so we continue to preserve that healthcare system.
That's all I got now.
And that's all Taylor's got. All right, questions from in here? Yeah, back.
What is the daily capacity of tests for Test Nebraska up to?
So what is the daily capacity for the Test Nebraska up to? I don't have that number off the top of my head. Dr. Antone, do you happen to have that by chance? I think that's actually one of the things we're trying to break out for Paul is the number of tests versus,
So we've done over 7,200 tests now, and I think on a daily basis, it's returning close now to 1,000 tests a day, if I'm not mistaken.
so Dr. Antone, we'll get the data and figure it out. I know yesterday it was over 7,100 tests had been returned back, and I know that we've been able to swab 500 tests a day from people, but we'll have to get back to with regard to that overall capacity, what we're actually doing, what we're actually experiencing. So why don't we do that? To Dr. Antone, see if you might just text Ashley and see if she's got that number handy. Paul.
I want to test Nebraska. I got an email from somebody said they were informed that the patient portal was broken.
I'm sorry, what now?
Patient portal was broken for Test Nebraska, and they couldn't get their test results.
So somebody from Test Nebraska said the patient portal was broken, they could not get their test results. A reader called in and said that the patient portal was broken, they couldn't get their test results. I have not heard anything along those lines. It might just be a hang-up with that person's results in particular. But we have not heard of anything widespread like that.
She said she was on hold for 40 minutes and then was finally told patient portal.
So
Hold for 40
she had been on hold for 40 minutes and then was told that it was broken? Yeah, I don't know anything about that, but certainly we can go check to see what the story is and follow up on that.
Governor, yesterday, 1,197 test swabs were done by Test Nebraska.
Yesterday, 1,000.
197.
1,197 test swabs were done by Test Nebraska yesterday. Yeah.
When do you plan to be up to the 3,000 tests a day?
So we are trying to plan to get to 3,000 tests a day. We're really pushing the team hard to try and get that done by the end of the month. But again, a lot of that will depend on people signing up. So for us to be able to get to 3,000 tests per day, we've got to have all 6 of our teams stood up, and they all going to be doing 500 tests a day. But we also need to be able to schedule 500 swabs a day from each one of those folks. So Again, as part of, we're going to need people's cooperation to be able to sign up for testnebraska.com to reach that 3,000. So please sign up, testnebraska.com. My little continued plug. Lee?
Have you been accepting people that haven't been showing symptoms to take these tests?
So the question was, have we been accepting people who have not tested positive or not been showing symptoms, rather, to get tested? And the answer is yes. So when we prioritize healthcare workers, first responders, food processing workers, and people over 65, you do not have to be symptomatic to get prioritized to be tested for those. So there is a fair number of people who do not necessarily have to be symptomatic to be able to get that test.
Sorry, I think I wasn't specific enough. We had a viewer call in and say that they didn't fall into any of those categories and were also accepted to take a test. Is that an exception to what's going on, or is that also happening?
So the question was, somebody called in and said they didn't fit in any of those categories and still got accepted to be tested. Again, we'd have to get the name of the person and look into it directly to kind of
You're
know.
not doing that on a wide scale. People aren't just being accepted to be accepted right now.
People are not just being accepted to be accepted. We're still looking at the priority, and it could be in the way, it could have been that they had an underlying healthcare condition, and so that maybe was one of the reasons why they got prioritized to be tested. So there could be some other things in the algorithm that prioritize them to be tested. Yeah.
So you had 4 sites yesterday, you got about 1,200 tests. How come you're not hitting the 500 site?
So again, the question was, hey, you had 4 sites up yesterday. You aren't hitting 500 site. You're actually hitting, let's see, what is that? 300 a day, roughly, right? So again, part of it is we got to have the people who are scheduling to be able to come in, and part of it's also learning. For example, one of the things we found is everybody who schedules doesn't always show up, and so part of it is finding that right balance of how many people we do schedule, understanding there's going to be no-shows to be able to make sure we're hitting that capacity.
Do you know what the amount of no-shows have been, or?
It can vary, but roughly you can have up to 15% of the people may be a no-show who schedule and then don't show up.
And did you just start doing some radio ads? I heard one today. Is that the first one out?
No, actually, we've been doing some, the question was, have we just started advertising? Paul heard a radio ad today. We've actually been advertising Test Nebraska. Taylor, for how long, at least on social media?
There's been radio ads running for about a week now.
The radio ads have been running for about a week, and how long have we been doing some social media stuff? About the
I
same?
have to look, but it's probably the last 10 days.
Last 10 days, maybe doing social media?
Is the cost of those ads built into the contract?
So is the cost of those ads built into the contract? And no, that's actually additional work that we're doing, again, using the CARES Act money to be able to pay for this, but to be able to help promote it and get the word out.
Given the importance you placed on mental health earlier, what is your reaction to Senator Sass's advice to graduates not to major in psychology?
So Senator Sass apparently advised people not to major in psychology. I think Senator Sass was trying to be funny when he was doing his ad. That's the way I took it, or when he was doing his speech. That's the way I took it.
He did say that part was not a joke. He stated that by saying 95% of gainfully employed psychologists' jobs is to help people forget high school. And then he gave that other bit of advice and said, that's not a joke.
Yeah, I think that whole stream was exactly supposed to, that's why I took it to be a joke. Yeah.
You keep saying when asked about future DHMs that you're waiting to see the data from how things have gone since you loosened restrictions on May 4th. What kinds of things are being watched? What are you looking for?
Sure. We're primarily looking at the hospital capacity. So if you look at the hospital systems, just about everywhere, it's been pretty stable. Here in Lincoln, we have seen more patients come into the hospital over the last couple weeks or so. I think right now it's running about 44 patients in the hospital. I think that's about right, Dr. Antonio. I think you probably got the stuff there in front of you. Is it?
I've got all the numbers, yes.
Yeah.
Do you want to know how many people coming in?
Or just how many people do we have in the hospitals here in Lincoln right now?
In Lincoln?
Yeah, Lincoln, Lancaster.
Tell you exactly that number. We have a total of 43 in Lincoln.
So it's 43 in Lincoln. So again, and that number is up from a couple of weeks ago from where it was. So we've been watching that. Same thing has been going on in Omaha. They've actually had a little bit faster rate of increase. I think we have 121 people in the hospitals in Omaha with coronavirus. So we are keeping an eye on that kind of stat to see how fast that is progressing. But again, if you look at Lincoln, they're over 80% of their ventilators are available here. it's over 60% in Omaha, the amount of ventilators that are available. So that's the kind of data we're looking at. We also are tracking just, again, the number of cases we're getting. We're looking for if there's any spikes in percent positives any place within the state, because that could indicate that we're having a hot spot. And then, Dr. Antone calls around, talks to the hospitals, and gets kind of a qualitative feel with regard to how they're feeling about the hospital systems. But, outside of Omaha and Lincoln, if you look at the rest of the hospital systems, we actually have declining censuses in just about everywhere, right, with regard to the number of coronavirus patients?
The only hospital outside of the Omaha area that has any capacity or has any real census right now is Grand Island, St. Francis, still with about 14, 15 patients in the hospital.
Yeah, so Grand Island, CHI Francis still has 14, 15 patients with coronavirus, but I think even their number of ICU patients has gone down, right? It's down 4. So we continue to monitor that hospital data to take a look at it, but again, we're keeping an eye on Omaha and Lincoln, but everything looks pretty good across the state.
Nebraska Appleseed was critical of your allowing the moratorium or the executive order on kicking people out.
Evictions?
Evictions, yes, to expire, and suggested maybe using federal dollars for rental assistance fund. Is that something you would consider?
So the question from Fred was, Nebraska Appleseed was critical for allowing the executive order on, what we did is we waived the requirement the courts do those evictions within 14 days. So to be clear, we didn't stop evictions, we just waived the requirement the courts had to do it within 14 days. And it was only for people who were impacted by coronavirus. And again, we've had that in place now for most of the months of March, April, and now it'll be the rest of May. So we felt like it was important that people did not get too far behind in the rent so that they would be able to catch up. And with the pandemic employment assistance of $600 a month, that was going to be sufficient for people to be able to pay their rents and so forth. And so since this was specifically focused on people who have coronavirus, was specifically around people who've been impacted by coronavirus, and that pandemic unemployment of $600 a week is also specifically around coronavirus impacted people, we felt like those two things kind of went together, so there really isn't a need to do anything else beyond that. Yeah.
I have some more questions focused on mental health.
Yeah, mental health. Can we have Sherry Dawson come up and talk about mental health?
We have heard from a lot of our local law enforcement agencies that they are responding to more suicide attempts and successful suicides in this time. That's one of their calls that has gone up. Do you know why this is happening? Can you just talk about some of the reasons why that issue is being exacerbated?
Sure. So I don't, thank you. So the question was, reports from law enforcement have identified individuals that are suicidal and have died by suicide, and to discuss reasons why that might be up. I don't have specific data numbers, but we have also heard, like our crisis response teams and other folks, and our family helpline and calls are definitely up. I think if you look at the pandemic and things that make us healthy, like social connectedness, like having a job and having purpose, and again, from a health standpoint, what isolation and the lack of that can do, I think some of that hopelessness and just, again, not taking total control of your health can certainly make a person's mood and experience be more depressed, let's put it that way, and socially isolated. And when we get that way, then that hopelessness, that certainly can impact our view of the world and the hope, and when is this going to end, that uncertainty. So I think there probably are people that are experiencing that, and the calls, and maybe even the system in which they used to call and receive help isn't the same way that they had previously. So that again, I think that isolation and social connectedness is and then the economic impact really impacts that.
If someone is experiencing those suicidal thoughts, or someone has a loved one who is, what are some steps that can take? How do you start that conversation?
Sure. So the question was, if you have a loved one or someone that are experiencing those thoughts and feeling hopeless, what are some of the steps that you can take? So first of all, I think, again, keeping an open conversation and those 5 warning signs that I talked about. If you notice those things in a loved one or friend, begin the conversation by just asking. You know, I've noticed that you don't seem yourself, or you're not as talkative, and kind of point out what's changed and open that up for a conversation about how are you feeling. What are the opportunities that maybe they can't see right now, and continue to encourage and problem solve. But if things are, if they're in enough distress, I think, again, encouraging them to get in connection with professionals, whether that be their healthcare professional to start with, or a mental health person in the community. It's just like a heart attack. We wouldn't wait until we're already experiencing severe symptoms before we'd have somebody say, hey, you need to go to the emergency room. And there are crisis response and people available. I encourage family and friends to notice what's happening, identify changes, and encourage connection to help.
Can you answer the senator's asked question? What was your reaction to his comments? Do you think it will hurt enrollment in that field study, given the Nebraska shortage of?
So the question was, do I have a reaction to the Senator Sass question in regards to his comments about psychology? And I have to say that I did not hear those directly. And so I can't comment on anything more than that. I would just say that I think that behavioral health field, whether it be psychology or other professions, are certainly something that we need, and encourage people to do that. Yes.
You talked about wanting to change the conversation and start a different conversation. What are some things that people can do to start that conversation?
So the question was that I had mentioned about changing the conversation. And so what are some things that people can do to start the conversation? So again, I think the opportunity is, if we're noticing those signs, that we just ask a person how they're doing, or identify some of the changes that you're seeing. Offer your help and support. If you have children and you're noticing those same things, and change in behavior, change in acting out, change in, again, are they staying in their room more? I think, again, having a conversation directly and just say, hey, I see you're in your room a lot more, and open, again, the door for children to have that conversation on a regular basis. There's nothing that the child can tell you that you can't help them with, and again, problem solve with them. I would say, again, when I talk about the physical health, that casserole disease kind of conversation, whatever a person, sometimes I hear that people don't know what to say to a person with mental illness or substance use disorder. And I would just say it's the same thing as any healthcare condition. So if you don't know what to say, it's okay to say, you know, I haven't known anybody that's had depression, but I'm here for you. Is there anything I can do? I'm here to talk. What would be helpful to you? Just like we probably would if they had a medical condition. So pretty practical kinds of conversation, and leaving the question open to the person, and let them begin to talk about their experience, and you just go on that journey with them.
Charlie Brogan wants to know, how many, you said that calls from suicidal individuals or people with mental health concerns are up. Do you know how much they're up, or do you have data around that?
You know, I don't have, excuse me, the question was do I have data in specific on the calls for help and suicide are up? I don't have those with me, Taylor. I certainly can get from our family helpline and our rural hotline, and get some numbers for you in regards to that.
I had a question in regards to how healthcare for mental health is provided is oftentimes in person, and a lot of that has been moved to online or then digital resource. How has your team or teams been able to overcome that and try and fight addressing mental health as a serious illness and a problem, but realize that it's that face-to-face interaction at the end of the day that oftentimes is able to help people get through those difficult times?
Sure. So the question was, behavioral health is usually a more in-person kind of a service. And now that we have the social distancing and the safety challenges, and people are doing more telehealth or even telephone for those services, what are some of the things that we're doing or our providers are doing to make sure people get their needs met? So I would say a couple of things. The opportunity for telehealth, and this is not just in Nebraska, but nationally, behavioral health professionals in some cases have been hesitant for that very reason that you talked about. We think of developing those relationships, and that needs to be in person, or seeing the whole person, maybe their body language, or if it's a substance, we need to be in person so we can smell alcohol, or those kinds of things. And I think we have had many providers that really went to the telehealth ahead of others. But what this crisis, this health crisis has done is made the opportunity for others that were not understanding that opportunity, that people still engage by telehealth. We have key partner calls each week. We've gone to bi-weekly now, I'll clarify that. And some of the things we have heard from providers is that they're actually busier now because the governor had talked about no-show rates, or somebody asked a question on the testing. And now that people are in their homes and they don't have to find transportation or, some of the scheduling challenges, that we have providers that are actually busier because there's a decrease in no-shows because people are able to receive the services by telehealth. We also have heard conversations about individuals in the substance use services that because the person, again, doesn't have to go to an office, that relationship through the telehealth has made some of those conversations even deeper and some more comfort in talking about some of the challenges that they've had. So I think the crisis has really kickstarted telehealth for some of the providers, and it's been a good thing.
All right, thank you, Sharon.
Thank you.
Paul?
Two quick questions. One is, have you had any progress in getting a call-in line for Test Nebraska? Is that coming? And do you think that's contributed to the kind of the flattening of the curve of people signing up for Test Nebraska?
So the question is, have we created that call-in line for testnebraska.com? We have not. Again, we're still focusing right now on getting the whole program down to be able to get to that capacity that we had talked about before. So I would say we'll continue to look at that as an option, but right now we're still focused on just trying to get the whole system where we want it to be.
And just so I'm clear, you said people need to sign up, we need to get people there. Have you not been able to fill up 500 slots?
So the other question is, have there been times where you've not been able to fill up the 500 slots? I don't know off the top of my head, Paul, what the capacity has been on those stats. We can look that up though and get back to you.
Okay. And can you talk about, you live in Omaha, Council Bluffs, a short drive. Can you talk about the pressure their governor's decision today to reopen some things puts on you to do the same?
Oh, so Paul said, does whatever Iowa is doing put pressure on us here in Nebraska to do the same thing? And it really doesn't. Again, Governor Reynolds manages her state. She's got other issues in her state that she's looking at that are different from what we do here in Nebraska. And again, we're really focused on the same thing we've been focused on for the last 2 months, more than 2 months, which is the hospital data. So our hospital data really isn't impacted by what goes on in Iowa very much. So we've been really focused on that to make our decisions.
But people come and go. It's easy to go across the river, to go out to eat, to go to a bar. Are you concerned that might contribute to higher rates in Nebraska?
So am I concerned that we might have people going to Iowa and then coming back across the border and bringing coronavirus here? Is that what you're asking? Okay, so no, not really. Again, people commute back and forth between Omaha and Council Bluffs, South Sioux City and Sioux City, Cheyenne and Scotts Bluff. So that's been already going on. And
You've been encouraging
yeah.
the work. You've been discouraging people to go to bars and close them
Oh,
down.
so the question is, their bars haven't been open, opened up yet either though, Paul, so.
No, but they soon
Hasn't been
will.
changed. Well, again, like I said, I told people just, hey, stay tuned. We're looking, we understand bar owners have been impacted by this, and we're looking at what we're gonna be doing in June. So I said, hey, just stay tuned with regard to that.
Are you gonna roll out whatever the plan is for June all on one day, or are you gonna spread it out next week?
Are we planning on rolling everything out? What we're trying to do is give as much information with regard to June, all at once so that people can have that to be able to start doing their planning.
What would you say to somebody who's having a wedding reception toward the end of June or July?
What would I say to somebody who's having a wedding reception at the end of June or July? I said, stay tuned. We will have guidance on that. So stay tuned. Hold out. Just wait for us. Yeah, in the back.
Is there a projected date or timeframe on when you're expecting to release those DHMs? Like, people who have weddings need to plan, people who run bars need to plan and figure out how to implement those changes.
Yeah, so the question was, hey, do we have a time frame on when we're going to be giving it out? I say, just stay with us. Again, remember, Monday, just 2 days ago, was really when we reached that 14-day point. So we needed about 14 days to be able to take a look at what was happening, to be able to start doing our planning for what we would be doing in June. So we've got a window here to be able to collect the data, so people just need to be patient with us for a little bit longer, and we'll be able to give them some guidance. We understand they want more time rather than less time to be able to plan. We're going to do our best.
I'm just trying
Lee.
to understand though, a few minutes ago you talked about how the state's hospitals have been doing great and statewide, the capacity is phenomenal. But at the same time, you're saying wait to track the data. If you're tracking it on a daily basis and you can see the state's doing great, why is the wait till June so imperative?
Well, again, so what we're doing is we're looking at the data for the first 2 weeks to be able to make that decision on what we're going to be doing for June. But we also need time to be able to talk to our public health officials to really kind of craft what those plans are going to look like. And then we want to give people time to be able to plan. So make that announcement in advance of when those things will actually go into effect so people can do the planning. One of the things, for example, we heard from the restaurant industry as we were looking at our May date is that they wanted to have time to be able to plan so it would be fair for all restaurants. That if we just surprise people, that some restaurants might be at a disadvantage for that. So again, we're trying to balance off all these different concerns to be able to come out with something to allow people to plan, but also make sure that we're doing our due diligence with our public health officials about what that will look like. And it just doesn't happen overnight. I mean, this all takes time to pull together.
We have time for a couple more questions.
Yeah.
Are you happy with how things are going with Test Nebraska?
I'm pleased with the results. We want to see things go faster with regard to Test Nebraska, but we are expanding our testing, which was the goal of getting Test Nebraska up and running. Certainly, as we've gone through the process, we found things to be able to improve, but that happens in any operation. So I want to continue to push on the team to be able to get to that goal of 3,000 tests per day. We're not there yet, but I've been very pleased with the results so far with Test Nebraska.
Do you think so far it's been worth the money?
So has it been worth the money? Absolutely, it's been worth the money. One of the things that, go back in time here just a little bit, when we were really working to expand our testing, having access to reagents, having access to test kits, having access to machines was all in short supply, and still is. It's still not easy to get those things. Now, it's easier. We're getting more flow of those sort of things right now, but when we signed this contract, that was not the case. And so this has allowed us to really start ramping up this testing much quicker than, say, for example, if we were just waiting to see if we could get more reagents through, say, the IRR that the CDC runs. Yeah, Paul.
I know, and I think you've got a letter on this. There's been requests to test all corrections officers, I think particularly at the Omaha facility that has the positive cases. What do you think about that request? Wouldn't that help you determine who has it? Maybe somebody's a silent spreader and actually bringing it in.
So the question was, test all corrections officers, and wouldn't that help with regard to our correction system? And I think what everybody's got to remember is that a test is a point in time, and that if you get somebody tested, the very next day they could go out and contract it. So it doesn't really help you from a long-term perspective. It does help identify people that then you can quarantine. And Director Frakes, for the correction system, has a plan for how to implement the testing based upon what we see, with regard to the facilities and so forth. So we've got a plan in place. It's very much, again, like what we've talked about for other things. So we got a plan that we're working, and that's the plan we're going to continue to work, that's
But how
been
would you
successful.
find out if somebody had it and didn't show symptoms?
So the question is, well, how would you find out if somebody doesn't have it and didn't show symptoms? And that's part of the challenge that we've got with this virus, is that it doesn't show symptoms. But think about it, let's take it to the logical extreme. If you wanted to test somebody, then you'd have to start, if you really wanted to test a population like that, you'd have to test every day, maybe even every half day, maybe even every hour. There's just no end to how often you have to test to ensure that the person who's not symptomatic isn't somehow getting through. And well, that's just simply not practical.
That's all the time we have.
All right, folks, thank you very much. Appreciate your time. We'll be back here again tomorrow, 2 p.m. Central Time for the English briefing, 5 p.m. for the Spanish language briefing. I want to thank all the folks who have been working to keep the spread of the virus under control. So please continue to do the social distancing, the 6-foot rule, avoid the 10-person crowds, all that sort of thing. Thank you so much for your sacrifice and everything you're doing. We're going to get through this together. We need to continue to all work together on all the things we're doing with regard to slowing the spread. Thank you all so much, and we'll see you here tomorrow.